Welcome, everybody. My name is Ugo. I'm a health professions advisor and at the College of Health and Human Science Student Success Center. I see some names that I recognize on the screen, so good to see you again. And Natalie is joining me. Natalie is an advisor as well, and she's trained to be a health professions advisor, but she's managing all the technology aspects of this workshop. And we are being recorded because we're going to put this recording on our website for when we have future appointments. We would ask the students to look at this presentation before they meet with us. That way they have some foundational knowledge. I did a workshop on Tuesday, but I was not feeling well, so it was not my best performance. But today I'm in top shape. So you guys are in for one of my better informational sessions. All right. Let me get to the next slide here. So again, my name is Ugo, and with me is Natalie. And the reason we're doing this workshop is because I meet with pre-PA students frequently. And I find myself repeating the same information over and over and over. And I thought it'd be great if next time I went with a student that they had all the information that's covered. At least they have the basic information about what it means to be a PA, what it is a PA, what are the career outcomes, expectations for this. Okay, so the reason I feel I'm qualified to do this is because I've been doing this for many, many years, and I am a member of the National Association of Advisors for the Health Professions. And we get frequent emails and workshops offered to us by representatives from various PA programs, from various medical schools, from various physical therapy programs. So I try to stay current with the developments in all the different health professions. This particular presentation I borrowed when I received training from the American Association of Physician Assistants. That's that logo you see at the bottom right of the screen. So a bunch of us advisors were called in for a workshop, and they gave all this content to us, and we asked all kinds of questions. Say, okay, now you guys are ready to go do it at your own schools. So I adapted a little bit to make it more relevant to San Jose State students. And so we're almost ready to start. I'm gonna hand it over to Natalie so you can do a quick poll. This poll is meant to kind of warm you up to the subject. It's not a graded exam or anything like that. Go ahead, Natalie.
Thank you, Ugo. Hi, everyone. Again, I'll be hosting today. You are able to unmute yourself. Please let me know if that's not available to you, and I'll make sure I do that again. But as of now, everyone's able to unmute themselves if you have any questions. And another more housekeeping is feel free to ask questions in the chat box, or you can unmute yourself, and Ugo is glad to answer any questions you may have, either after he's done with the slide or definitely after the presentation. And just a reminder, this presentation is being recorded and live streamed on YouTube. So let me launch the poll.
It's being live streamed for people who need captions.
Yes. So go ahead and start filling out. It's only 3 questions. And if you have any questions, now's the time to ask as people are completing the poll, either in the chat box or you can unmute yourself.
So as you guys are doing the poll, the agenda for today is first we're going to talk about the career. What is a PA? What do they do? That's going to be about 10 minutes. And then the next 10 minutes are going to be about what do you actually learn in PA? What does it mean to go to PA program? What do you do to get your master's degree? And the bulk of the session, which is why you're here, is to what I do. What can you do to best prepare yourself to be to have the best outcome when you apply? Obviously, to get into program, not just one program, but hopefully your first choice program. So that's my ultimate goal. And then we'll stay. That'll end around 6 o'clock, and I'll be happy to stay till as long as 6:30 and answer any questions. And you can do them through the chat box, or we can do it by unmuting yourself and voicing them. We're just waiting for 5 more people to finish.
Mm-hmm.
maybe they're stuck. Let's go ahead and proceed, Natalie.
Yeah, sometimes there's some technical difficulties. That's okay. I'll go ahead and
Yeah.
end the poll and share the results. So as a PA, I can specialize in dermatology, oncology very easily, yes or no. 71% say yes, 29% say no. Number two, getting through PA grad school is much easier compared to medical school, yes or no. 67 believe no, and 33% say yes. Number three, all PA programs have the same prerequisite courses, yes or no. 29% say yes, and 71% say no.
Okay, we'll have all that information for you in the rest of the workshop. So let me close this out. All right, so the PA profession has been around for a little bit over 50 years, about 52 years. And it's a very reputable profession. It started off in middle 1960s when medics were coming back from the Vietnam War with all these skills. So we had a resource of medics who were trained well in the Vietnam War. And we also had a big need for primary care providers. Primary care providers are people working in the community as family practitioners, pediatricians, internal medicine, and OBGYN. So Duke University had a good idea of training these medics to become primary care providers, and it grew and grew and grew, and to where it's at right now, over 120 PA programs nationwide, working in a variety of settings. What do PAs do? What do physician assistants do? You guys practice medicine. What does that mean? PAs are professionals who are able to take a history, conduct a physical exam based on what the history tells them, order diagnostic tests. Those three things help you come up with a diagnosis or a differential diagnosis. Differential means I'm not sure, but I suspect it's a strep throat, but I'm going to look for COVID, I'm going to look for tuberculosis, I'm going to look for these other things, but I suspect it's just simple strep throat. Let me see. And so once you diagnose somebody, you come up with a treatment plan that can involve prescribing medications, and then maybe follow-up meetings after that, especially if you have somebody has chronic disease like diabetes or hypertension, heart disease, something like that. And usually you'll serve as the patient's primary care provider. That means you're their first contact when something goes wrong. That's what that means. And think about this. Think about the last time you went to go see your clinician, your doctor, your nurse practitioner, or your PA, and you showed up with X, Y, and Z symptoms. The first thing they want to know is, what kind of symptoms you have, how long, how intense they are. Then depending on what you reported, they did a specific physical exam to listen to your lungs, listen to your heart, move your arm. So whatever you reported is what they're going to examine for. Then they're going to order anything from blood tests to ultrasounds to CAT scans to X-rays. Those are the diagnostic tests. From those, they say, this, great news, you had nothing. It's a cold, take some aspirins, call me in the morning, or I'm sorry, but I think you have diabetes. We're gonna do some more tests, but meanwhile, let's get you started on the treatment for that. So that's kind of what that means. Now, the PA workforce is essential for the health of this country. There's this Healthy People 2020 program that Center for Disease Control has put together, setting goals for, how we want the country to be healthy in. For example, leading health indicators, which are, in other words, how do we measure the healthiness of a country? One is access to health services. PAs help serve the underserved communities within the primary care system. In other words, communities that have a high degree of uninsured populations, or people on public insurance, such as Medi-Cal, Medicare, Medicaid, and who don't normally have access to services as well as people who have private insurance, like Blue Cross, Blue Shield, Kaiser. So PAs are very essential for that. PAs are also a part of the preventive services. We want to screen patients for colorectal cancer, for pap smears, to catch disease early before they, they become life-threatening. Those are called preventive and clinical screening services. We often catch, PAs often are important in catching early symptoms of diabetes mellitus and other chronic illnesses. And just as important, vaccination of children and infants during their baby checks, during their annual or monthly exams. Those are the kind of the areas where PAs work and that are part of the planning that's taking place to improve our health outcomes. And I will just highlight, for those of you guys that are public health majors, I put social determinants of health. This is not me putting it in, this is the leading health indicators. It's important that PAs know what social determinants of health are and how that can impact what takes place in the clinical setting with regards to patient care, with regards to policy, and with regards to potentially doing research to improve outcomes based on social determinants of health. PAs are also politically active. Your American Association of Physician Assistants is your voice to improve what you can do as PAs. In other words, up to maybe 10 years ago, 15 years ago, PAs could not prescribe. You can write a prescription, but you needed it co-signed by a physician. It's due to the advocacy of your national organization. All 50 states are now allowing PAs to write prescriptions without having it co-signed by the physician. That improves patient care, it improves function and efficiency in the clinical level. Like I said, increased access to healthcare. For example, the Affordable Care Act, also known as Obamacare, one of its key components was increasing access to healthcare. Prior to Obamacare, there was estimated 30 million people without insurance and therefore without access to healthcare. Due to Obamacare, that got vastly reduced. I believe the last number was 11 to 12 million that still didn't have insurance, but that meant that 18 to 20 million Americans now had access to health insurance. And as a result of that, PAs became a great demand. As a result of that, there's been a big upsurge in opening of brand new PA programs nationwide. So you guys are, when you guys become PAs, are part of our future planning for healthcare access to people. And because you guys are working upstream, in other words, preventing disease, we are lowering healthcare costs that way. So PAs are trending up. Every indicator show that the job market is really, really good. You should not, once you become a PA, you should not have any trouble finding a job. And it's transportable. You can get trained here and then move to Texas because it's hard to buy a house in California. Or if you can't get into California, you can go to Texas, Idaho, Arizona, Oregon, wherever, and you can be a licensed PA anywhere in the country. So all these entities, Forbes, U.S. News, Glassdoor, all talk about how good the job market is for you folks. I feel like a salesman, trying to talk you into being a PA, but I'm just trying to be, keeping it real using information and data. So PAs can practice with autonomy. Sometimes people think that a PA, has to have the doctor sign off on everything they do. So PAs do have to be supervised by a doctor. That means it can be as simple as every quarter, every three months, a doctor who supervises you will look at your medical records, pull 10 at random and look at what you did and verify that you are in fact practicing quality medicine. But you don't have to consult with a physician for every patient. You don't have to consult with a physician for every prescription you write. You can do that whenever you feel the need. So yeah, this profession pays well. This is for a slide for fresh out of school. You can expect to make $85,000 nationwide. It's probably going to be a little bit higher in California because we have a higher cost of living, therefore we pay a little bit more. But PAs that migrate into different specialties, internal medicine, pediatrics, surgical, etc., can make either less or more. But you can expect to make that kind of money once you get out of training. With time, you'll make a little bit more. So this is people, PAs who have been in the profession 5 or 6 more years more once out of school. PAs can practice different areas. The majority of PAs practice in primary care settings. There's an increasing number of PAs that are practicing in the hospital setting with specialties, and some of the urgent care centers, etc. Some PAs will practice at your local college health center. So PA programs last up to 24 to 27 months. So it's basically a quick master's, 24 months, maybe a little bit longer for clinical rotations. It is a full-time gig, so you cannot work. Once you get into a program, many PA programs will actually have you sign a contract saying that you will not work, because if you do, you may jeopardize your ability to stay in the program. You may flunk out because it's just too demanding on you. There's 2 parts to the PA training. The first year is basically all classroom. The next slide, we'll talk more about that. And then the second slide, after this, we'll talk about what do you do in the clinical rotations. And after you graduate from the PA program, you then take a national exam called the PANCE, P-A-N-C-E. PANCE stands for Physician Assistant National Certification Exam. It's a big exam. PAs usually study 3 to 6 months for this exam, and they usually are able to work. So in other words, once you graduate, you have provisional license saying you can work as a PA while you have the test, but you have, I believe, 6 months, up to 6 months to take this test and pass it. And then after, you can't work anymore until you pass the exam. So the first year is called Didactic Year.
Do you mind going back 2 more slides, please? No, the next one. The next one.
What was your question?
Oh, I didn't see the last bullet points.
Oh, folks, I'm gonna send this slide out to you guys. I forgot to mention.
Oh, okay.
Yeah, I'm going fast because I only have an hour.
Oh, okay.
So just write your questions down. But by next Tuesday, you will be receiving this slideshow by mail. Okay. In a few minutes, I'm gonna stop and have you register so we can have your email address.
Okay. Thank you.
So sorry about that, but I really gotta go fast. If you have any questions,
okay.
Save it for the end, and I'll be happy to answer all your questions. Okay.
Okay.
Thank you, though.
Thank you.
Okay, so what do you study during your didactic year? You're going to study subjects such as anatomy, physiology, pathophysiology, pharmacology. Then you're going to start, getting into the juicy stuff, clinical medicine. How do you diagnose somebody? What are the different types of diagnosis? With a neurological diagnosis, the endocrinological diagnosis, the oncology, cancer diagnosis, et cetera, et cetera. But it is rigorous. Look at this, 20 credit units per semester, per term. In other words, some of us struggle with 15 and then taking anatomy as part of those 15. And then you take physiology with 15, and that can be a challenge. The point is that by the time you graduate, your study system, your efficiency as a student will be much more improved, and you can handle 20 units. I have many students who graduate and go on to PA program. They tell me, I knew it was going to be rough. I didn't expect it to be this rough, but it's definitely doable. Okay. And they do say, I'm glad they made us sign that agreement that we weren't going to work because we don't have time. Even our relationships suffer. My wife, my significant other, is complaining that when am I going to see them? And I say, soon enough. This is just a 2-year gig, and then we're after work, and we can reconnect. But yeah, it's gonna be very challenging. So is it as hard as medical school? No, medical school is much harder, but it's not easy either. Okay. And that's why you have all those prerequisites that you have to take, because it's basically a crash course in medicine. Medical students do it in 4 years, PAs do it in 2 years. So it's like you get crammed with a bunch of stuff, but it's more practical. In your clinical rotation, which is the last 12 months, you have to do mandatory. And each program has slightly different qualifications, but at least 6, as many as 8 different rotations. You have to do family and internal medicine, pediatrics, emergency medicine, women's health or reproductive health, surgery and psychiatry. And then some schools will allow you to do as many as 2 electives. And during those electives where you can explore where you might want to specialize after this. So in other words, when you graduate as a PA, you are trained to go out into primary care. And primary care means you have exposure to these areas of medicine. Some of you may decide to migrate into, for example, ear, nose, and throat, an ENT PA working for a ear, nose, and throat MD, or you can do be like a surgical cardiac surgeon PA. Doesn't mean you're doing cardiac surgery, but you may be assisting in surgeries, but more than likely you're doing the follow-up, the post-operative care. That's pretty basic. Just looking for infections, that the valves, is it functioning properly, things like that. But that's where you explore it, is during your electives, and you will be at all times under the supervision of a clinician, which is an MD, a doctor of osteopathic medicine, that's a DO, NP is nurse practitioner, or a fully licensed PA. So after this, you graduate, and then you start paying back your loans. I don't know of any PA who's gone through without loans. So the average PA will bring in some undergraduate loans, some loans from college. At San Jose State, the average student that graduates has $25,000 in loans as of 2019. And the average debt for PAs for PA program is $90,000. You add the $25,000 plus the $90,000, you can expect to owe around $115,000. Some will do it for less because you were really good about budgeting your money and you're really good about writing for scholarships. But expect to owe a good amount of money. Now, not to discourage you, I put back the slide about how much you'll be making. So most of my students who go off to PA programs will pay off their loans within 10 years. Okay, you still have enough for your rent, for your mortgage, et cetera, for vacations, et cetera, but you will pay off your loans, your $115,000 within 10 years because you're making good money. When you apply, you'll be using a centralized application service called CASPA. Okay, I'm saying all this terminology because we're going to be using it, whether with me or when you attend an info session. You got to use CASPA, you got to use PA, you got to use DO, you got to use PAEA, Physician Assistant Educational Association. You got to use on the lower right AAAPA, American Association of Physician Assistants, because you're entering into a culture, the PA culture, the pre-PA culture. So you got to start adding these words to your vocabulary. Okay. So there's right now 190 programs, and there's more coming up every year. And so, most of you want to stay in California, but the reality is that some of you will have to go out of state because California is one of the most competitive places to study for medical school and PA programs. And there's an easily accessible link on here for you to find as a database, basically, of where the programs are at. Here's a map of where the programs are located. I know most of you want to stay in California, but some of you might go to UNLV of Nevada for graduate school. For some of you might go to AT Stills in Arizona. AT Stills is a very good program, but they don't have a new program in Santa Maria. But I also encourage you to keep Oregon and Idaho and Washington. New Mexico, probably not so much so because they're pretty much only take in-state. But also Texas is wide open. If you're willing to be adventuresome and go to Texas, you have a good chance of getting into those schools as well. And Florida is also wide open. So those are trends where our applicants are starting to make inroads into, because again, California is the most competitive. I do encourage you to apply to a California school, but don't settle for it. I'm only going to apply to 2 schools because I'm going to absolutely get into California schools. I would encourage you to have that mentality, but as a backup, I'm going to apply to some, a couple of Arizona schools, a couple of Texas schools, a couple of Florida schools, just because I want to be a PA so badly. I want to go out of state. Now, Natalie, can you load up into the chat the link for this conference? This is a virtual conference, and Natalie's going to put the link on this. It happens twice, sometimes 3 times a year, and you can easily get access to as many as 60 recruiters and representatives from admissions programs from admissions for the different PA programs. The link will take you here. All you do is click on registration. You put your name, your email address. There's no fee for this, and they'll let you know when the next PA virtual fair is. It goes from 9 to 5, but you don't have to go the whole session because, I was able to log on for an hour and then visit 2 or 3 programs, because they have breakout rooms, and then, see a few more students, and in the afternoon log on for another hour. So it's a great way to talk to various reps, and just ask your very specific questions about what kind of patient care experience are you guys accepting? What kind of GPA profiles got into your program last year? Do you guys absolutely require the GRE, and what kind of GRE score should I be shooting for? Those are the kinds of questions you can ask. And then one other fair would be the UC Davis pre-health fair. I just signed up for free. It used to be a $25 fee and you had to go to UC Davis, but now because of COVID-19, we can do it virtually and without cost. It's primarily a pre-med conference, but the last few years, because of the growth of the PA profession, they've added more programming for PA students. My favorite here is going to be the Deans of Admissions Roundtable discussion. Usually pick 4 deans, 2 from California schools and 2 from out of state, and they sit around and they share what they're looking for in students, what kind of patient care experience they're looking for, what kind of GPAs got in, et cetera, et cetera. That's my other favorite workshop that they offer through here is the panel of students. These are students who are currently in PA program, where they talk about what they did to prepare for the PA profession, and what it's like, what does their day look like while they're studying while they're preparing to get their either didactic or clinicals. Strongly recommend you do those at least twice. One, just to get a scope for the programs, get some initial impressions, and then the second time is right when you're getting ready to apply, sort of like finishing. Any lingering questions where that's going to impact where you apply and how you shape your personal statement. Those are the reasons why I encourage you to attend these at least twice. All right. Woo, we're right on schedule, Natalie. I'm gonna hand it over to Natalie.
Thank you so much, Ugo. A lot of information, guys. We're at this point in the presentation where I'm going to send the link for the attendance sheet. And now would be a good time also, if you have any questions, to put them in the chat box, or you can unmute yourself and ask Ugo any questions you may have. So while we take a few minutes until like 5:31, 3 minutes to do the attendance sheet, now is a good time to ask any questions you may have.
So as you fill in this form out, one of the reasons why you should opt in to get on our email list is because I bring at least once, sometimes twice a year, PA programs to campus, so you can meet directly with the representatives. My goal is to bring University of Pacific, hopefully before the year is out, if not early next semester. And then we will be having a PA application workshop and a personal statement workshop, 2 different workshops in spring. And we want to make sure you'll get the first, you get this information in a timely manner. And so that's why we want you to register so we can have you on our listserv.
I have a question.
Sure.
So I'm personally a graduating senior, and I'm looking into doing hours right now, because I know some of the requirements for PA school is hours, patient care hours. I've been asking everywhere, and I know there's some that have said virtual shadowing. Do you know anything about that, about hours?
Yeah, we're gonna talk about that coming up, but while people are waiting, I'll go ahead and precede this. I've been keeping an eye on the virtual hours, and the PA programs are reluctantly accepting these. So in other words, if you have 50 to 100 hours of virtual hours and somebody has 75 to 100 hours of of real hours because they were doing it a year ago, they're going to pick that other person.
Mm-hmm.
Because in other words, if your GPA is compared to their GPA, your letters of recommendation compared to their letters of recommendation, more than likely their personal statement is going to probably be a little bit, if not a lot better, because they were in person there watching that, you know, getting all this fantastic experience. So my recommendation and my approach, why I'm doing this session is I want you guys to apply once and get in. Not apply once and then be just short of it, and then you apply again, or you give up. Okay. So, and Vanessa, before you graduate, I encourage you to make an appointment with me, so we can strategize about that. Okay.
Yes, I'm currently a psych major, so it's due to COVID and everything going on, it's kind of hard to I'm having trouble trying to find hours, if that makes sense right now, because
the same trouble that everybody's having.
Yeah, that's my issue right now.
If you were my daughter, and I'm old enough to be your dad, but I'm not. I'm probably old enough to be your grandfather, but I'm not. If you're my you know, my family member, I would say, Mija, take a gap year. Wait for oh, by the way, folks, please vote. Please vote, because we should be doing much better with COVID, with good leadership, with good public health mentality, using science and public, you know, City Center for Disease Control. We should be easily flattening the curve already, but we haven't. So we need better leadership, you know, at all levels of our government. So hopefully, well, not hopefully, all indicators are that a vaccine is going to be in place and start being disseminated by January, February. For those of you who are public health majors, we know that we have to immunize at least 70% of the population to have what's called herd immunity, H-E-R-D. The projections are that by fall of next year, we should be very close to herd immunity, and we'll be wide open again, which means that next fall we can expect to have, potentially, if everything goes well, classes, in-person classes. Then Vanessa can go out and knock on the door and say, yeah, come on in. We're happy to have you volunteer at our hospital or work as a scribe. So there's, you know, in other words, your limited opportunities right now won't be limited once we get herd immunity.
So what do you I'm graduating this December, so what do you, I do plan on taking a gap year, because like you said, the point of this workshop is to get in at that one try, and that's what I want. What do you, I know COVID and everything, what do you recommend doing? I'm
gonna answer your question at the very end, because I have a bunch of slides to show you that's gonna actually make you think a little bit. Okay,
thank you.
And then if I don't answer your question, I want to talk to you in person through an advising appointment over the next couple of weeks.
Okay, thank you.
Okay, Vanessa, I look forward to meeting with you. Okay, and I'm gonna answer your questions, but through some data, some graphs. Okay, I'm gonna move on now. Okay, Natalie, can I move on now?
Yes, thank you.
Thank you. All right, now, like I said, I've already recruited you guys. Y'all want to be PAs because, you know, it's a great job, great opportunities. The training is challenging but very doable. Yes, you're gonna owe some money, but you're gonna have a well-paying job. You can pay it off in 10 years. So there's a lot of reasons why you should continue to be a PA. But you still got to get in. So here's what I recommend you do. Why is this such an important career for you? And you shouldn't address this from the perspective, and I drew a red arrow from there to the personal statement, as, in other words, you can think that it's a good job, but you can't say it's a good job in your personal statement, okay? You know, it's good hours, I don't have to go to medical school, I can practice medicine with all that depth and, you know, all that sacrifice. That's not gonna get you in. You gotta talk about patient care. It's my duty. I want to address social determinants of health. I want to be part of the primary care solution to our healthcare needs. You know, and talk about patient care experience that you've had. So that's why you think this is a profession for you. The next step is, if you don't already have it, what is the best major for you? In other words, it doesn't matter what your major is as long as you get the prerequisites. And if you look at the next few slides, maintain a strong GPA, or I didn't put that in, but have a very nice GPA trend your last 60 units. Some of us didn't get off to a great start fresh sophomore year. So say, for example, and I'm talking about me, when I was a frosh, I took Chem 1A. I was not prepared for Chem 1A, and I barely passed. I got like a C- or a C. Same thing with anatomy when I was a different major. And so, you know, common reasoning says, you're not going to get in. But many schools practice what's called holistic review. They will allow you to take those classes that you didn't do so well in earlier in your career because you showed that the last 60 units, you were on top of your game. You ended with a 3.5 or 3.75 your last 60 units. So now you go back, either here at a community college, you retake those classes, you got a grade that you're not satisfied with. Anything less than a B- is something you should retake. And then some schools will practice what's called their own version of grade forgiveness. They'll take that best grade the second time you took it and not worry about that C or C- you got the first time around. As long as not all your prerequisites, okay? You don't want to do that for all your prerequisites. But 1 or 2 or 3 prerequisites, you know, they understand that life happens and sometimes you're not as prepared as you could be for college. And that meanwhile you're maturing and becoming a good student. So that's what that means. GPA or GPA trend. You're gonna need, you know, when you apply to be a PA, you gotta have a complete package. You just can't have certain areas strong and other areas weak. Everything has to be strong because you're applying to a very competitive process. So you gotta strategize for where am I gonna get my letters of recommendation. You're gonna need one minimum academic letter. So from a faculty in psychology and anatomy and chemistry and one of your public health courses, whatever your major is. And then another from somebody who supervised you in the clinical setting, a PA, an MD, an NP, an RN, talking about, you know, how you did in a clinical setting with patients, et cetera, et cetera. They may ask for more, but that's a minimum requirement. Definitely attend some conferences, like I already mentioned. I also encourage you to do info sessions as you're especially your last year before you apply, just to get that final set of information you need to prepare the best application possible. Many programs require that you job shadow physician assistant. As a volunteer, it's really hard to get these because of HIPAA. HIPAA is the confidentiality law that governs all healthcare processes in the United States. And so many hospitals and clinics do not want volunteers shadowing physician assistants. You may have better luck in private practice. In other words, an MD or a PA in private practice, they're more apt to let you shadow them. But if you're working in a setting as a medical assistant, as an EMT or whatever, then you're making networks with physician assistants, which you can then recruit to be your mentors and say, you know, now that I'm an employee of such and such hospital or clinic, you know, can I clock out, not work, and then as a volunteer be a you know, shadow you. And that's part of what I want to talk to Vanessa about, strategizing about getting good patient care experience. I don't like to give a blanket answer to everybody because we really got to tailor it to your situation, okay? But I'll give you some ideas later on. All this information up here is going to help you write a really good personal statement about why PA and why you. Okay, that's basically what you're going to be asking. And they're asking for about a 5,000 character, which is about a page and a half. I recommend, and I'm going to talk about this with my personal statement workshop in spring. I recommend you write 8, 9, or 10 pages. In other words, while you're getting patient care experience, keep a journal. While you're taking the anatomy class, keep a journal. What did you find fascinating about biomedical information and potentially applying it for the health of others? While you're doing patient care experience, you know, if you saw something that really impressed you about what took place to the patient or certain attributes that the clinician had. Sometimes clinicians use humor. Sometimes they use cultural competence to obtain maximal effectiveness in patient care. Sometimes they use empathy. Sometimes you see a clinician who has an exceptional listening ability, and et cetera, et cetera. All these things that you think would be traits that you want to emulate once you become you want to write that down and talk about that in your personal statement. Yeah, and then research programs, take the GRE, apply to CASPA. In general, the ones, the column on the left are the required courses. This is what most, if not all, PA programs require. Bio 30 and 31. Some of you think, I took Bio 21, that's cool. No, they're gonna want more. Some programs are okay with Chem 30, but most require Chem 1A and 1B. Chem 30 is general chemistry, 3 units worth. Chem 1A and B is general chemistry, but covered in much more depth and rigor over 10 units. Anatomy, physiology, biology, 65, 66. Most programs, well, some programs require biochemistry, most strongly recommend it. Why? Because the combination of bio 30 and 31, Chem 1A and B, and that, those are the prerequisites of biochemistry, and biochemistry is really the foundation of pharmacology, which is one of the courses you'll be studying in PA programs. They all require statistics. Some require microbiology, and I have a table coming up in a little bit. Some are fine with just Psych 1, others require Psych 110 as well, normal psychology. Some will have in their websites for requirements, either we just recommend it or we strongly recommend some of these courses right here. If their language on the website says we strongly recommend it, then you better take it. It's code for, it's really required course. We just not ready to put it up under required courses. GPA, I know that's a big bone of contention for many of us. All right, so this is data from CASPA for the people that got into PA programs 2 years ago. If you look at the first column with a 3.47, that's the average or the mean that got in nationwide. 5,611 students started PA programs. This is what their average or their mean GPA was, with a standard deviation of 0.32. That standard deviation is important. If you follow this first arrow, 3.47, I put it down here, some little math demonstration. And then what you do is you subtract 0.32 from 3.47, you get that 3.15. You add 0.32 to 3.47, you get that 3.79. So that's the range, okay? Let me scroll down one more slide. Here's a bell curve. So the 3.47 is the mean, it goes right here. One standard deviation over to the right is 3.79. One standard deviation over to the left is 3.15. That means that if you look at 34.1 in here in the blue, 34.1 plus 34.1 is 68.2. 68.2 of the students that got in nationwide and are in PA programs right now were within this range, 3.15, 3.79. All right. If you find yourself applying with a slightly lower GPA than that, okay, you're still in the ballpark. Okay, we may have to strategize, but don't be discouraged. But you got to end strong your last 60 units. You got to go back and fix any of those C's that you might have gotten, and that will definitely improve your chances of getting in with a GPA that below a 3.47. That's why I don't just show this slide, because it's going to scare a lot of people off or give a lot of people overconfidence. Okay, you got to factor in the standard deviation, and every program has their own internal data on what got in and what was standard deviation for what got in year after year. And that's what some of the questions you might want to ask when you go to these virtual sessions that I recommend you do. Here's the big view, the holistic view of comparing Stanford, Touro, Samuel Merritt, AT Stills. AT Stills is a brand new university in Santa Maria. It's a very reputable university that started in Arizona. And they're primarily a DO school, Doctor of Osteopathic Medicine. I really like their program because they're focused on community medicine. And this is how they compare with their prerequisites. You'll notice Stanford does require micro. So I put micro 101 at San Jose State, or a comparable lower division course called Micro 54 at San Jose City College. Other community colleges have similar courses as San Jose City College. Basically, you're looking for a microbiology course that covers bacteria, viruses, and fungi. Our Micro 20 will not suffice. Our Micro 20 at San Jose State only covers bacteriology. Okay. This is what I encourage you to do, to make your own table as you're getting ready to apply. And this is how you narrow down your list of 15 schools to maybe 10 or 12 schools, because you realize that you meet the requirements for these, etc. And then I put in the clinical hours. And this is what Vanessa Pineda was referring to earlier. Stanford says we need 500 hours, but they don't specify what. Others like Touro do specify, and my next slide will show you the language from Tuoro's website. They can be very specific or more general. And the slide after Tuoro's is University of Pacific's, and it'll give you more of the language they use for a program that requires, in less specific terms, patient care experience. So just know that it can be substantial. And we do got to plan for that, strategize around that. And just to drive home that point, you really got to plan for substantial hours for national acceptance, okay? I recommend you shoot for about 1,000 hours. Don't settle for the minimum of 500, okay? Because this is what's getting in. Well, you can apply. You want to have an applicant's profile that looks more like those who were successful rather than those that just applied. Anybody can apply, but you really got to be on top of your game to be successful. So that's why I encourage you not to have a certain timeline. In other words, I'm going to graduate. I'm going to apply right away because I want to be in the PA program by the time I'm 24, and then graduate by the time I'm 26, then get married by the time I'm 27. Unfortunately, again, you can apply when you're maximally ready. That's my recommendation, because applying is a very expensive process, both emotionally and financially. Yeah, this is more of the same. Some programs will actually say, if you don't have a 3.0, we're not going to look at you. Don't even bother applying. And they mean that, okay? Most of them will say, our competitive programs have a GPA about 3.40, but remember, that standard deviation is not factored in yet. So don't rule yourself out if you're not a 3.4. Talk to me first. This is what's commonly shown as examples of strong patient care experience. Nursing, emergency medical technician, and sometimes when you become an emergency medical technician, you can migrate over to the emergency room, become an emergency room technician. You can see a lot more as an ERT than you would as an EMT. Medical assistant is a very common one. Nursing assistant is also a very common one. I put scribe on the left because it's not direct patient care, but some programs are starting to value scribing more. I don't think you should put all your eggs in scribing. I think you should significantly count on scribe and a combination of something else. Now, some of you may not know what a scribe is. A scribe is somebody who types all the information that you see during a patient encounter into the medical record, shadowing the clinician. And you're you're an employee, so you can see everything. Remember, when I first described what PAs do, I talked about taking a history, doing a physical exam, ordering diagnostics tests, getting all that information from those three and coming up with a diagnosis, and then having a treatment plan. A scribe sees all that, okay? A medical assistant sees about 40 to 50% of that. An EMT, ERT sees about 40. So I like scribing because you see the whole thing. Your vocabulary improves. You get a feel for the reasoning they used for how you ask questions, how you take that information to do a certain type of physical exam, to then order a certain type of diagnosis test to get your absolute or prospective diagnoses. But there's value too to being in direct patient care. Can you handle patients who are upset, that are ill, that are vomiting, that are throwing up on you, that are bleeding out? The smells, the sights, somebody screaming, sort of the negative spot, but also the positive spot, somebody smiling and thanking you, et cetera, et cetera. So there's merits and demerits to both. The demerit for this is you don't see the whole thing like a scribe does. The demerit to the scribing is that you don't get that feel of direct patient care. So I think the combination of both is important. Here's a language from Tuoro, from their website, about what their value as patient care experience. If you notice at the bottom, they actually give you examples. CNA, clinical nutritionist. I mean, these are things that actually require training. So if you don't have that, if all you're counting on scribing, I would not even bother by applying to Tuoro unless it changed, okay? And Tuoro is a very good school, especially those of you who want to get an MPH along with a Master's in Physician Assistant Studies. You get two degrees in 3 years with an MPH being. So if you're interested in doing preventive healthcare and clinical medicine, towards a good place for you. They do have strict requirements when it comes to patient care. Here, in my opinion, is one of the more I won't say less strict, but more understanding of patient care experience requirements. University of Pacific and their main university is in Stockton, but their clinic, their PA program is actually in Sacramento, right next to University of Davis Medical Center. And I did talk to the medical director for University of Pacific when the last conference they had at Davis last year, and he said, Hugo, we'll accept scribing. We encourage them to do things besides scribing, but if the rest of your application is good, we'll accept scribing. So this is a personal conversation he had with me. This is not, doesn't say right here on the website, but that's what he said. So I'm targeting him to come back to campus again, either later this semester or next semester. Again, it's going to be through Zoom. He was scheduled to come to campus middle of March, but then COVID hit, so we have to cancel that. Ooh, I got 9 minutes. I got to hurry up. So I'm going to skip some of this. You'll get this through your through the email. So letters of recommendation. When we meet with me, we got to strategize about that, because if you're one of 100 students in an anatomy lecture, it's going to be very hard for you to get that letter of recommendation, because I've talked to professors before, and they say, and if there's a class of 100, maybe I might write 1 to 2 letters of recommendation for that class. And sometimes I write letters of recommendation for people that got B's and not for those that got A's. Why? Because I got to know them. They came to office hours. We had conversations. I got to know them a little bit. I got to see something I could write about, as opposed to somebody got an A who I never saw. All they can say is they got an A, but that's already in the transcript. So there's a whole strategy to this that we want to talk about. And the other question is, when should you request these? Okay, and we're going to cover all that during your application workshop in spring. PA job shadowing, as was mentioned earlier, this can be very, very hard to get. So one strategy would be to actually work in the profession as a medical assistant, as a ERT, as a CNA. And in the process, you'll recruit a PA to be your mentor. It's natural. You'll have interpersonal skills. They all know that you're there as a scribe or as a CNA or as an ERT to get experience while you're applying the PA program. If you're a college age student, they know you're either going to go to medical school or the PA or NP programs, and you're getting that experience. So it's going to be fairly easy to strike up a conversation. Say, can I have a cup of coffee after out of work, and just to chat about this, and then sometimes, they will be able to talk to their supervisor and say, that ERT, emergency room technician that's working with us, his name is Hugo. He's a nice guy. He's really sharp. He's very respectful. Do you mind if he clocks out when, and shadows me as a volunteer? He's already been through the HPA training, the patient confidentiality training, so the risk is very, very small. Usually, if you've proven yourself and you're a good employee, they will say, yeah. Okay, so that's one way to get PA shadowing experience outside of the actual work experience. Talked about that already. GRE, just know that you may have to take it. A lot of programs require it, some don't. So as you're making your short list of programs, you may choose based on whether they have to take the GRE or not. The GRE takes about 3 weeks, solid weeks of 4 to 5 hours a day of prep, and you'll have an acceptable score. Personal statement, like I mentioned before, why you? Why physician assistant? Okay. So the way the admission system works is they look at your numbers first, your GPA and your GRE scores is necessary. Then if you meet the minimum criteria, or whatever they call benchmarks, like the 3.3, 3.4 GPA, then they'll look at your personal statement to see if they want to invite you to submit a secondary or supplementary application. Every school has supplementary applications, their own additional list of questions they want you to answer. Some will actually invite you for an interview. Others will just base their decision on the supplementary questions. So you really want to put a lot of effort into a good personal statement and have that be part of your story. In other words, your story is a personal statement, the letter of recommendation that talks about you and the attributes that you have that are mentioned in your personal statement. and then finishing it up either in the supplementary application or the interview. All that has to be like one good story about who you are and why you'd be such a good fit for their school. Many schools are mission driven. For example, I mentioned AT Stills earlier. Stanford has their own mission. And so you want to write, you want to apply to schools that have mission statements that are similar to why you want to be a physician. For example, AT Stills mission statement talks about serving the underserved, that their goal is to produce PAs who are willing to go back to work in underserved communities. And they're looking for evidence of that in your personal statement and your resume. And did you volunteer? Did you do, where did you get your clinical experience? Was it at as working as an ERT, or maybe it was a medical assistant at a community clinic, maybe it was a volunteer clinic, et cetera, et cetera. So they look at all those things. And so you want to apply to programs that are going to be a good fit for you and their mission. And again, I can help you strategize for those when we meet. Yeah, so applications open up in, I believe, April or May. So we want to get your application ready to go out the door by the latest May or June. Most programs are rolling admissions, which means that they're going to look at these applications every week. Whatever they get every week, they're going to look at them, either send you a supplementary or send you a rejection notice, okay? So you don't want to apply too early just to get your application in, even if it's not well developed. But you don't want to apply in August just to, just because you're not on top of your game. You didn't get those letters of recommendation at the last minute. You really want to time everything really, really well because, like I said, you're putting a big investment in terms of time and energy. Okay, I am done. I finished 3 minutes early, which means it gives us more time to do questions and answers. I'm gonna hand it over to Natalie. But meanwhile, Natalie, if you could please put up the link to the pre-PA club email, because I strongly encourage you to join if you're not already a member of the pre-PA club. If there's a member of the pre-PA club, you're welcome to unmute yourself and invite everybody to join. Nobody?
Thank you, Ugo. I put the pre-PA club email there, and I'll now put the survey. Again, if you're having any troubles, let me know. But this survey is also to help us out to make sure that our workshops are even better the next time. And you can rate us of how effective we were today. So thank you so much for your time today. Again, if you have any questions, there are some questions in the chat box, Ugo, about having a, what's the average application cost, and if they wanted to take a break in the year, would that be good? So that there's some questions on that.
Okay. Let me first put up, in case you want to make an appointment with us, you can call these two numbers down here. Natalie's going to put those in the chat room as well. The first one, 924-2910. That's if you call in the morning between 9 and 1, somebody will answer and schedule you. And the second one is for the afternoon, 924-8601, in case you dial in after 1 before 5. All right, now I'm going to stop sharing and go to my chat so I can start answering questions. So the first one is apply. So what I meant by not applying too early or not too late is that apply if you can by the latest June 1st or first week of June. It's not a hard deadline. And so that's why we're having these application workshops every spring. You can attend whenever you're ready. You can apply as a fraud. I mean, you can come into these workshops as a fraud, so a sophomore, junior, or as a senior. And we go over how to get letters of recommendation, how to secure them so that you're not asking for them last minute. We might even rehearse asking a professor for a letter of recommendation. So because too often students say, "Can I get a letter of recommendation from you?" As opposed to, "Would you be able? I'm applying to the PA program. Would you be able to write me a good letter of recommendation?" Emphasis on good. And if you like, I can share with you a version of my personal statement just so you get to know me a little bit better. And then if you have an interest, we can set up a time for you to interview me or talk to me in case you want to add more substance to your letter. Okay. See, instead of just getting it over and running away, you actually you tell the letter writer that you're willing to work and share with them whatever they need to be able to write you the best letter possible. And so all that takes strategy, takes timing. And so I think that's a long way of explaining that you want to apply early enough, but not too late into the cycle, because otherwise, by the time you apply in July or August, you're really only applying for the last 4 or 5 seats. The other 55 seats have already been given out to somebody else. Okay, so that's you're really reducing your chances of success by applying later. But you're not improving your chance of success submitting an application early that's not ready to go.
There weren't many questions in the chat box. I noted one earlier. It said, would you recommend taking a gap year to gain experience?
I do. I don't know if I don't think I put that slide in there, but the average age, and I'll make sure to put the slide in for when we do send it out. The average age for the first year PA students is 26 years old. Okay. All that means is that, they took the time to really know why they want to be a PA, to really build layers upon layers upon layers of preparation, to really go back and tighten up any courses that might have been, that might hurt their chances of getting in, that C or the C minus, anything below a B, just to improve your chance of getting in, to show that you have high standards for yourself. So that's what people do during their gap year or 2 or 3. So you apply when you're confident that this is your best chance to get in. And so if it's a gap year or 2, then that's what it takes. I had a student who took 6 years before she found her path, and she said, I would not do anything differently. I had a blast learning and experiencing. I met some amazing patients, some amazing mentors. And then not only that, but once she finished her training at Stanford, she said, I had no trouble getting an internship and a job because, I had to work in all these places as a medical assistant, and they knew me. They knew what I brought to the table. All right. Okay, Eric Fregoso, if you try the pre-PA club, if you don't mind forwarding me the email that you sent them, and I will send it directly to the chair. And I will say, you asked me to promote you guys, but yet you guys don't respond. And I will kind of, not to embarrass her, but to make sure that they're more on their prompt. The other thing, Eric, and this is out to everybody, if once you get to join the PA club, here's an opportunity for leadership, because I know that the PA club has had leaders that moved on, and they've had trouble getting new leaders on board. So there's potential to improve the function of the PA club, and if you're willing to invest in your leadership development to leave the club better than you found it, that's a good reason to do it. But the ulterior motive is that would also bode well for your applications if that comes up, and when I ask you in the secondary, have you had an opportunity to demonstrate leadership? There's where you go. The reason I say that is because sometimes PAs are asked to be lead PAs in a clinical setting. There's like the medical director, right? But then there's also the lead PA, who's somebody who's senior, who has leadership ability, who has communication ability, et cetera, et cetera. So yeah, don't shy away from opportunities where you see a leadership void or an opportunity for you to contribute to the greater good. So yeah, so Eric, please forward me that email, and I'll make sure that somebody responds to you right away. Vanessa, you have a question? Please raise your hand.
Yes. Sorry.
And after Vanessa, hold on. Vanessa, after you, Malia, can you unmute yourself after Vanessa, and then you can go after Vanessa. I didn't see you, but go ahead, Vanessa.
Thank you. I was wondering, what's the time frame to study for the GRE? Because if I'm not mistaken, I believe some schools don't require the GRE, but I've been doing some research and everything, and it's better if I take it. So what's the time frame, or you have any tips on how to study for that?
Let's assume you're gonna take a gap year. I would do it this summer.
Summer.
Yeah, the basic treat for the basic approach for the GRE is to practice test after practice test after practice test. And every time, you know, you do the practice test, you maybe do a little bit of content review, a little bit of vocabulary review, a little bit of a statistic review, because there might be some statistics in there. And then you take another practice test, because the test is timed, and you're training your brain to answer these questions as best you can, sometimes even giving educational guesses, you know, at these questions. And after a while, you get pretty good at it.
Yeah. Thank
But
you.
yeah, I recommend you do that summary before you apply.
Okay.
I'm sorry, Malia, but I skipped over you. Malia, can you unmute yourself?
Yeah, I'm sorry. I just had a quick question about your personal.
It's your time, my friend.
Oh, thank you. Well, I was just wondering if your personal statement workshop, because I signed up for the emails in the survey, I was just wondering if I would get an email regarding signing up for it and all the information.
Yes, you will. You'll get, by signing up, you're going to get this PowerPoint, and you'll get the first invitation as soon as we get it organized, so you can block it off.
Okay, thank you.
And then people that attend my workshop are then able to send me versions of that I can give critique to. Yep.
Oh,
I won't edit it, but I'll give you comments. Oh, this is too wordy. You know what? It needs more passion. And I might even call you up and say, tell me about what you just described in the personal statement. And then you describe it to me. I say, okay, here's how you phrase it, because it's missing a few adjectives, maybe a more first person storytelling voice. And I've done this for many years. I'm very good at it. But I'm only going to do that for those people that attend our workshop. If you don't attend a workshop and you email me, hey, can you look at my personal statement? I'm going to say, nope, I don't have the time, which is true. I wouldn't have the time.
Okay, thank you so much.
You're welcome. Thank you for asking. Emily, go ahead, please. Emily Tran.
Hello, I had a question regarding what's the average amount of schools that people typically apply to?
The average successful PA student applies to 12 schools.
12 schools, and how much?
A lot depends on your GPA and your the type of experience you have, because you may have a profile that I'm pretty confident based on my experience saying, you know what, if you want to apply to 5 schools, you have a good shot of getting in. On the other hand, I may look at your GPA and your personal and your patient care experience, and I may recommend, you know what, you're competitive someplace, probably not in California. You're welcome to apply in California. You may get in, but I recommend you expand your net a little further, and I recommend these schools in Texas. For example, I just sat in on a workshop offered by the University of Carnegie Ward in San Antonio, Texas. Okay, they have a very good ABSN program for nursing. They don't have a PA program, but they're getting one organized. They have a very good physical therapy program. So anyways, I sit in all these workshops to see who's recruiting our students. And then I'll have conversations with their admissions directors, and I get a feel for what they're looking for. And that way I'm better able to recommend where you might have a good shot, California-wise and out of state.
Awesome, thank you. I have one more question, sorry.
Sure, your time, go ahead.
What's the average for like one application cost-wise?
I would say budget for about $1,200 or so for if you're gonna apply for 10 to 12 schools. That's not counting travel in case you have to go for an interview. That's just for secondaries, for the GRE, for the initial application. Yeah, so definitely it can be a little expensive.
Wait, I'm sorry. Did you say 1,000 per application?
No. If you're gonna apply to 10 to 12 schools.
Okay. Sorry.
Thanks for clarifying, because I might have misspoken. I know it's scary. 1,000 per application. That's 10,000. No.
10 schools there. Okay.
On average, it costs between 1,000 to 3,000 to apply to either physical therapy, PA, or medical school. Happens to be that medical school is really, really expensive, but the PA programs are a little bit more, are about a third as expensive for applying to 10 to 12 schools.
Well, time to save up. Thank you.
Yeah, so that's what I'm saying. It's very complicated. There's a lot of stuff going on, and you really got to strategize, you know. Abigail? Or Abigail? Your turn.
Okay, great. So remember the slide that you posted about which courses were required, and I see that English with composition is required. Is that English 1A and 1B?
Yeah, I'm gonna delete that because basically, if you got a degree from us, you got your English 1A, your communication classes. Yeah.
Oh, okay. Because for my major, it doesn't require English 1B, just only English 1A.
Yeah, you only need English 1A.
Oh, okay, okay.
Critical thinking is a graduation requirement anyways, but maybe not for your major. What major do you have, by the way?
Biological sciences.
Okay. Caitlin, you're next. But meanwhile, Abigail, yeah, forget about that English 1A. It's pretty much mandatory for everybody who graduates from college.
Okay. And also, does AP classes, like, so I don't know if it's a different class, but I got credits for AP Stats. So does that count for the statistics in college, or do I have to retake statistics?
Yeah, it'll count. They just won't factor that into your GPA for prerequisites. On the other hand, if let's say you got you're like a 3.2 GPA. I don't know what your GPA is, but I don't know. I'm not outing you.
Yeah.
Let's say your GPA is a 3.2. And you're saying, man, I want to get a 3.3, so I'm gonna go back. I already passed AP, but I'm not. It's been a while, so I'm gonna take that the statistics at a community college and get that A. That might bump you up a little bit. So strategically, that may be worth it for you.
Oh, okay.
But I'm happy to meet with you. When you're ready, so we can discuss that strategy, see if it's necessary at all.
Okay, great. Thank
Get
you.
it to apply.
Okay. And also so for UOP, I was actually gonna go there for undergrad because I live in Stockton, so it's just near, but it's a private school, so it's super duper expensive. That's why I didn't go. But so financial aid doesn't count when you go to grad school, correct? Like there's no, okay. So that's where the loans come in.
Yep.
Okay.
So strategically for you, you would want to look for schools that are that have a lower cost tuition cost.
Right.
But ultimately, I do encourage you to apply for schools where you have a good shot, even if it means you owe another 20,000 more than that 115 that I projected earlier, because you're gonna, it's important that you finish what you started and you get into any program, but you do want to be selective and be budget smart and reduce your loans if you can.
Okay, so grad school is the same price as undergrad except no financial aid.
Not always. So you really gotta, as you're getting ready to pick your schools and you attend an info session, that's one of the things you will ask. You will ask the when you apply when you do the info session, say, what is the average cost and what is the average indebtedness of your graduates? You write it down. You put that in that table. Remember, I showed you the table for prerequisites. You put that down in your table, saying, okay, Tuoro's average cost is this, and this is what their average debt is for their graduates versus Samuel Merritt versus University of Pacific versus AT Stills in Santa Maria, et cetera, et cetera. So all those are going to be factors which will help you make your choice as to where you're going to apply.
Okay, great. I think I'll just make another appointment with you because I have a little bit more questions. So
sure,
yeah.
Good questions. Thank you for asking them, and thank you for giving somebody else a chance. We'll talk some more later, Abigail.
Okay, thank you.
Caitlin, thank you. Bye bye. Caitlin, your turn.
Hi. So yeah, I asked a question in the chat like 12 minutes ago, so you can refer to that. But basically, I'm a systems physiology major. So I'm taking like Bio 124, which is like systems physiology. And like you said that we had to take Bio 65 and 66, but I'm going to be taking basically the equivalent to these courses, just like more advanced.
You're
so
right.
I don't see the point in taking Bio 65 and 66 if I'm taking the more advanced versions.
Sure.
So
have you taken anatomy or any kind of anatomy?
I'm going to be taking Bio 165 next semester, which is like the advanced anatomy.
Yeah.
So
I can't speak for all programs, but I'm sure most of them are going to say, yeah, we'll rather have you over prepared by taking these upper division anatomy physiology courses than then just regularly prepare it by taking Bio 65 and 66.
Yeah, thank you. I just didn't want to take both because it's kind of repetitive.
And I do encourage you to ask the same question when you participate in the the conferences at UC Davis or the PAEA one that they do virtually. That way you get the directly from the voice of the admissions representatives, the same answer I gave you.
Okay, yeah, I will. Thank you so much.
You're welcome. My wife just came home. So my wife's a PA. She actually went to San Jose State for their nursing program. She worked a year and then she went straight into Stanford's PA program. And then she's been doing it for 28 years, 30 years. And the last 20 years, she started off as a general family practitioner, general medicine. And the last 20 years, she's been focusing on reproductive health at a community health center. And most of her patients are underinsured or uninsured. So she's a true hero to me in my eyes because she's my wife. But she's also serving the most needy. Anybody else? Good questions, please. Just go ahead and unmute yourself and.
I have a quick question.
Well, take your time, Eric. Go ahead.
Okay, so I'm a public health major and I'm a freshman, and I know that we, as a degree, have to either concentrate in community health or like
data science or
yeah, data science. Like there's these two new ones that used to be something else, and the major used to be called like health science, and that's public health. Or we can either minor in something. For PA school, like in order to progress and to cover as many prereqs as possible, would you recommend I minor in something like biological science or concentrate in one of the two concentrations we have here?
Eric, that's a great question. I wish I forgot to mention that earlier. The recommended pattern for public health majors is if they want to go pre-PA, remember I said recommended, it's not a rule, is to minor in chemistry. Because through chemistry, you'll be able to get your Chem 1A and B, organic chemistry if you want to, and then biochemistry as well. Then you could take your Bio 30 or 31, I recommend at a community college over the summers or, as a gap year. And then anatomy and physiology. I think anatomy is now required for your major, right?
I think it's because they keep like changing it. I know a lot of people who are upper division who are like seniors and juniors, and they said that some people took it and some people didn't. I think I might have to take it. I think I'm just going to take it anyways.
So the people that started the major before the change are held to the old requirements. If you started the major right when it happened, you're held to the new requirements. And the new requirement does require Bio 21 and anatomy. So, but if your biology experience was really good in high school, Biology 21 is equivalent to AP biology from high school, except we teach it in 15 weeks. In high school, you did it over a year, correct?
Correct.
So if you had a good biology experience in high school, you might want to go directly into Bio 30. And then you can skip Bio 21. You don't have to take Bio 21 for your major because it's a more rigorous biology. So they're not going to hold you to Bio 21 because you're taking a harder course. But it's totally your call as long as you get a good grade.
Okay, that sounds good.
And let's meet and we'll plan that out. Okay.
Okay.
Good question. Well, thank you for letting me answer that question so everybody can benefit from it.
No problem. And I'll also forward you that email that I sent the PA club. Please
do. And then we'll train you to be one of the leaders, and pretty soon you're going to be as a sophomore or junior, you'll be the president of the PA club.
Okay. Thank you so much. And have a good day.
Everyone else is listening. No.
Yeah. Thank you.
You're welcome.
Looks like we have a hand raise with Melanie, and then there's a question in the chat box about if you could talk a little bit about applying to provisional, probationary, accredited schools.
All right, let me answer Melanie's, and I'll answer the question about provisional, probationary school. Okay, Melanie, go ahead.
Hi, Hugo. Thank you for all, first of all, thank you for all the information you presented. It was very useful. My question is, when emailing the pre-PA program, like what do I say? What do I mention in that email? I'm not really sure.
You're talking about a specific program. Let's say you're emailing Stanford. Is that what you're talking about?
Oh, no. I'm talking about the club. Sorry.
Oh, okay.
SJSU.
Just say, I heard about you at the pre-PA conference held by Ugo and Mel and Natalie, and I'm interested in joining. What do I do to join? And what kind of? And then once they join, say what can I expect? What are we going to do? They usually invite PAs to give talks about what they're doing and their trajectory. Sometimes they do some community service stuff. But they haven't, I know they're around, but they haven't told me what their plan is for this year. One thing you can do, and is you might want to see if there's pre-PA clubs at other campuses. In other words, look up Cal Poly San Luis Obispo, look up UC Davis, and do a search for a pre-PA club. Call them up and say, we're at San Luis State, but we want to see what you guys are doing. Maybe we can borrow some programming that you guys do.
Okay.
So just to see if there's something that you can borrow from them that you might want to incorporate or suggest that our pre-PA club do.
Okay.
Because before this job, I had a job at UC Santa Cruz, and we started a pre-PA club there. I had a group of students who want to start it, and then they called up UC San Diego, and they borrowed what they were doing and they implemented into their model for running a pre-PA club. It worked.
Okay. Thank you so much.
You're welcome. So somebody asked a question about provisional, probationary, and accredited schools. Okay. So when you look at the CASPA website, or I'm sorry, the PAEA database for programs, PA programs nationwide, there's going to be a column that shows whether the school is accredited, provisionally accredited, or probationary. So let's say I'm starting a new school at San Jose State. I'm not, but hypothetically speaking, and I file the paperwork with the accreditation agency. They're going to come out, do a site visit, look at our curriculum, look at our facilities, and then if they like it, they're going to give me a probationary accreditation. And then I have a year, and a year they're going to come back and look at everything again, and if they like everything we did, they're going to give us provisional status. And then we're not provisional, so we do that for another year or two. I don't know exactly how long it is. And then if they like what we see, that we're meeting all their standards for educating PAs, then they give us full accreditation. So let's say there's a school that gets audited by the accrediting agency, and they're supposed to accredit every 2 years, something like that, and it's not doing too well. Their passage rates on the boards is lower than acceptable. Their labs, they don't have a certified anatomy instructor, because they left, things like that can show up. Or so things, the yellow flags come up, they get a report saying you got 1 year to fix these. Meanwhile, we're going to put you on provisional status. Let's say they don't fix it. Okay, you said you didn't pass provisional status, we're going to put you back on probationary status. You have 1 year to fix it. Then if you get off probationers, if you don't pass that, then they pull their accreditation away. So some schools that are provisional might be more desperate for students. So if your GPA is low on the low side, then you might consider applying for a school that's on provisional accreditation. I would never encourage students to go to a probationary school because they may not be there the next year. It's your choice, but I would not encourage you to apply to a school that's on probationary status.
So would you say that it's probably better to apply to accredited schools more often?
Yep.
Okay.
Yeah, as part of your strategy, definitely plan for an fully accredited school. But then again, depending on your GPA and your patient care experience, you might, as part of your strategy to get in the first time, apply to a couple of provisional schools. And then if you get accepted and you visit them and you're satisfied that they're gonna give you a good bang for your buck, then accept it.
All right, thank you.
You're welcome. 5 minutes. Who has questions for me? Odalis, how about you? Do you have any questions for me, Odalis Salvador? No? How about Juan Moran?
Yeah, sorry, I don't think you can see me, but all the background's really bad.
That's all right. I like that groovy, Golden Gate Bridge behind you. Go ahead, man.
So I was just thinking, so what is the process like for the DACA students? Does it vary much?
That's a very good question, buddy. You're my first, maybe it's not you, but you're the first person to ask that question. Let me ask that because, okay, I do have the answer for that. You're able to apply, get in, and then practice in at least in California.
Right.
So every state has different criteria. California is very welcoming of DACA students, whether it's nursing, PT, or OT, or PA.
Right.
There's probably a few other states that are that. And I would, if you connect with me, I will send you the email to a very good organization called Pre-Health Dreamers.
Okay.
And they have the latest information on which states are DACA friendly.
Great. Okay. Thank you so much.
Please follow up with me either in person or by email. I prefer in person.
Okay.
And then we'll talk about that.
Yeah. Great. Thank you so much. Appreciate it.
Welcome, man. Stay, keep the faith.
Yeah. Thank you.
And vote. Anybody else?
Yes, I just have just one little question. It's not like it's just like a question I'm just wondering. I think I missed like the beginning of the intro, but are the co-hosts, which is Hugo, which is you, and Natalie, are you guys PAs?
No, we are advisors.
Oh, advisors. Okay.
Yeah.
And part of my intro was that I've been doing this for many years.
Mm-hmm.
And I've also a member of the National Association of Advisors for the Health Professions. And as such, I get regular updates from PA programs and the National American Association of Physician Assistants. And then through that, I also get special trainings just to make sure that my information is current. And also, because I've been doing it for many years, I've had many students go off to many different health professions, including PA. So I know what it takes to get in and how to coach you to be strategic in your approach to applying.
Okay, got it.